Good afternoon and welcome to our session this afternoon. We'll be starting in 1 minute. Just to let you know that the session is going to be recorded, so we will be sending it out, the recording and the slides, but we're just going to wait a couple more minutes for people as they start to join. Thank you for joining this this afternoon. We are just going to wait a few more minutes, or just 1 or 2 more minutes, just for people to join. You are here for the CPD session of support for disabled students in higher education. We will be recording this session, so we'll be sending that out with the presentation slides after the event. So sometime next week, you'll get those as well. Okay, we are going to launch a poll. If you could just answer that. It is anonymous, but I will, bear with me. Let me see if I can launch it. Hopefully this will launch out. Hopefully you can see that now. Can you see that, Jackie?
Yeah.
Brilliant, lovely. We'll leave that up just for 1 minute, and just as everybody else joins, and there will be another poll at the end with a couple of questions as well. These are anonymous polls, so please do answer them.
I can't see the question. I can just see a tick and a cross. Is that right?
Yeah.
Oh, no, there should be the questions. So bear with me. Why is that not?
Oh, we've just got a tick and a cross.
Right. Okay. So something's not working there. Let me just put Emily, could you put the question into the chat? Oh, that's not going to be anonymous then, though, is it? That's not going to be fair.
If we tick, what happens then if we tick?
I don't know. I don't know why it's not launching the poll. Bear with me 2 secs. Sorry about this. Bear with us. We just want to make sure that we're getting. Hold on. Let's see if we can launch it. See if that works. There we go.
That's it. That's it.
Give you 1 minute and then we'll start.
I'm sorry to be a pain. I think that's the one that you use at the end.
Yeah. Is it?
So following this session, how would you rate your?
Okay. These polls aren't working very well, are they? Okay. Hold on. Let's start this. Thank you. Right. We'll launch that, and then I'll have to add the next one in. So is that better? Yeah. So please ignore that. Sorry for these technical hitches.
No, that's the right one now. Yeah. Brilliant.
Okay. Well, that's good because we've got someone else just coming in now. Thank you for joining us this afternoon. We're just about to start our support for disabled students in higher education. There is a poll in the chat. Please do add to that what your thoughts, and we'll start the session now. So thank you so much for joining us. As I said, this session is going to be recorded, so you will get that recording and the presentation slides. Okay, so just a bit about who we are. We are the Higher Education Progression Partnership, and we are funded by both universities in Sheffield, so Sheffield Hallam and the University of Sheffield. And predominantly we go out to schools in South Yorkshire and North East Derbyshire, so Sheffield, Barnsley, Rotherham and Doncaster. So we go out and deliver lots of impartial advice and guidance to young people and adults out in those settings. Now, today what we're going to cover in this session is sort of all about accessibility, so understanding that higher education is accessible to disabled students, the different terminology, because it can be very different from school, some of the terminology that is used in higher education, the support that's out there, so lots of different support that is available and how they set that up. Then a bit about DSA, so Disabled Student Allowance, and how you can encourage students to apply for that. And then some guidance, provide guidance on supporting disabled students when thinking and considering about higher education. Okay, so I'm going to hand you over. Each of my colleagues is going to introduce themselves as they present today. So I'm just going to hand you over.
Hello, thank you. My name's Jackie Reaney and I'm Disability Advisor for Higher Education at the Barnsley College University Centre. Do you know, it gets longer every time I say it. Barnsley College University Centre, Higher Education Disability Advisor. And in one respect, it doesn't matter which of us is speaking, because the DSA process is a national process, and it's exactly the same in every university or every college of higher education, or everywhere that delivers support and delivers courses to level 4 and above. So you could start finding out about this from any one of us, and it will be picked up and continued into whichever university very seamlessly, because it's the same system we're all working to. Because it is highly dependent on a shift in language, we thought it would be really useful for you to know the things that you will hear about in HE in universities, and the things that you will cease to become so familiar with as your students move up into level 4. The first thing is that the word disability will be bandied around a lot, and for a lot of people that is a phrase that they've not been used to using for a health condition or mental health condition or dyslexia. But actually the point of disability is that in education it's used to cover anyone who has a diagnosis of something that impacts upon how they study. So whether it impacts on their concentration, their access to print, their reading, their comfort, levels of comfort, their access to the building, as if there is a means by which a student feels they face a barrier because of a health issue or a diagnosis, then that is included in the phrase disability. And just as a bit of a history lesson, it harks back to when the Disability Discrimination Act came out in the 90s. We fought very hard to get education included in that, so that the same legislation that governed people getting access to services and goods nationally governed student access to courses where they felt they had a condition that impacted upon their attendance and course engagement. So we fought very hard at the time to ensure we kept that phrase disability, and to remind ourselves and our users, service users, that we are governed by the law. We've a legal requirement to make adjustments around students who have a diagnosis. So that means, therefore, that we have to try and encourage our students to get used to that phrase disability, because when we get into university, that'll be the phrase disabled students, it'll be about disability support, and it'll be about disability professionals delivering that support. So SENCOs around and about in FE situations and in schools won't be found in universities. You will find instead disability advisors or disability coordinators. Essentially, it's the same business, but it's that phrase disability again. And the SEN team, the Special Education Needs Team or Learning Support, will then become disability or inclusion or well-being. And that's really important, because I've known students spend 3 years in a university looking for additional learning support. It's not there, there isn't a learning support. And it isn't there. It's called disability services. So it's really important to become comfortable with the phrasing that you can expect to find at university. The learner in FE and in school might not need a solid diagnosis in order to get extra time in exams, or in order to get access to a separate room, or in order to get some flexibility of study. But that becomes more important, and this is quite crucial in higher education and in universities, because Student Finance England require a full diagnostic report in order to grant access to DSA funding, Disabled Students Allowance. They require a full diagnostic report for dyslexia. They require solid medical evidence from an NHS professional or consultant in order to get support around a health issue or anxiety or a mental health issue. There has to be a piece of evidence with an NHS logo on it. The EHCP, interestingly, will count as evidence for a student with autism. Anyone with ASD, if it's cited within their existing EHCP, at this stage when we are arguing that the student is entitled to this support, SFE will accept the EHCP as evidence if it clearly states the student is on the autistic spectrum, has ASD. Interestingly, and we don't know why this is, but SFE, interestingly, if the EHCP states Lisa has is diagnosed with autistic, being on the autistic spectrum, and Lisa has dyslexia, and Lisa also has a bad back, then Student Finance England will say, we accept the evidence of autism, but we will require additional evidence of dyslexia or of the bad back. So be kind of forewarned and forearmed that there will be a requirement for students to present what would be formal evidence of any medical issue, including anxiety and including dyslexia. So the EHCP loses a bit of its validity in that it becomes Disabled Students Allowance, and in that we do take account of it as disability advisors. We take account of everything that's been delivered within that, but it's repackaged into a level of support that is accessed through Disabled Students Allowance. So those are mainly the things that where the language is different. A disability service, as is in every university, could be delivered by 12 people or 20 people, a whole team. In our higher education institution, there is just me, so I'm a one-man person. But the service itself does the same job in every university, and we like to be seen as a resource for access by our students throughout their 3 years. So it's not just for us to get the students on board with a DSA at the start, but to be there as a source of support and as a source of guidance throughout. So it's really important that students get to know where to find the disability service and how to access that. When we talk about equal access, that's not just about making sure the doors are all automatic or that there are lifts. It's not about physical access. It's about access to everything that your student would need in order to feel that they have a fair experience at university. So it might be equal access to extra time. It might be access to being able to take exams in a separate room. It might be access to a quiet space to sit in to resume some composure around anxiety or panic. It means really that we get the chance to make it as fair for everyone who is facing a barrier around a disability or a health issue as it is for everyone else. And for that reason, personalised support, our role within each university is to devise for every student we get to know a level of support that matches how they work. Okay, and that will be different for many students, and it means that we have to meet with the students and we have to tailor that support and those adjustments around how best they work so that it is fair and it is tailored to individual needs. Confidentiality, well, the service is entirely confidential. We ask for the evidence we need in order to get students the support they need from SFE, but we send that evidence nowhere. It sits with the Disability Service team. It goes to Student Finance England to get the DSA sorted, but it is not shared as medical evidence or psychological evidence throughout the university. What we do is lift from that evidence onto a separate plan those pieces of information that we want to share with, that you would want us to share with tutors and support staff. They might not need the medical details, they certainly don't need the medical details, but they do need to know that that means this student will need extra time, or that this student will need a chair with good back support, or that this student might need to exit the lecture for regular comfort breaks. So confidentiality is an absolute must here. Early contact. By early contact, if a student's starting this September, we mean now, because the forms have come out in March for application for DSA, and every year forms come out February to March for students to begin to apply for the DSA funded support ready for September. So by early contact, we don't mean your first week on the course, because we're aware that Student Finance are handling so many students that it takes 2 to 3 weeks to 2 to 3 months to process the application start to finish. So if we meet or link up with a student today, it could be August, September before that package of support is ready to be delivered to the student. That's why we work to make sure that support is available, kind of sitting on a cloud, even if the student isn't aware of where they might end up, but the support sits on a cloud until that student knows, oh, I'm going to be in Cambridge or I'm going to be in Sheffield, and then it's delivered to them at that point or just before that point. It doesn't matter that the student might not fully know where they're heading, as long as they've applied to an HE course somewhere. We can get to work with putting that support together. So early contact means from now right through the summer up to the point of entry. Thank you. So this is what we are, Disability Advisors and Coordinated. We are, as a team, a dedicated point of contact, and that could mean through an email, or it could mean through a named person or a named section of the university. So it might be a wellbeing section or a disability services. Familiarise yourselves as you advise the students on going to open days with getting them to ask what is the disability point of contact, so that at open days they can find out how to contact the service over the summer. As I said, we provide ongoing advice and guidance, not just at the start, but during the course. So if suddenly you develop a bad back or you're diagnosed with dyslexia, then you come back to the service and you say, I would like this to be added on to the support I'm already getting for my ADHD. And we do look at previous support where you bring it to us. So if you tell us, this is what I had at school, then we'll know about it and we can start to look at putting something similar together. So for yourselves as members of staff, be aware that we will not get access to the historical support that has been delivered in FE or at school. We can't, I've known students say, but you must know about it because it's in all my records back into school. Because the students are 18 at point of entry, we can't access previous records and we have to work to what that student brings to us. So if a student chooses not to disclose a mental health issue for whatever reason, or a bad back or whatever, if a student chooses it, that is their right as an 18-year-old to say no to it, and we won't know about it until perhaps we've built up sufficient trust with them for them to begin to disclose more with us. But, you know, the key is to encourage your learners to disclose as much as possible, because there isn't provision for us to access earlier support that's been delivered at school. We identify the appropriate university support. This is where I would say I would be sending around a reasonable adjustment plan, or we might be saying a learning contract, or something that advises the tutors. Liam is going to need regular time out from lectures to regain his composure. There will be times when Francine needs to access support in the library. And so we let the tutors know how that student will be working and what they might need. And we do it through a plan that is put together in conjunction with the student in discussion. So it's not something we put together without a student's input, but it does allow them to determine what we would tell people. And we guide them through the DSA process from here on in. As I've said, every year the forms come out in February/March, and so we can begin that application process even now, so that by September everything will be in place for a nice smooth transition into university. The easiest way to get that first slice of information is for you to encourage applicants to complete a UCAS form. I think they start during September or October completing the UCAS forms. And on page 1 or page 2, it asks a student to tick a disability column. And please encourage your students to do that. That tick of the disability column is only going to end up on at the desk of the disability services team. It won't go around to your tutors, it won't be shared elsewhere. It is simply so that we all get a list of applicants who have ticked the disability box for whatever reason, and it therefore gives us our initial idea of a workload, a caseload of students to begin work with. So I'm really concerned that students feel okay about ticking that box and understand that it isn't going to be shared widely round the university. And then back to importance of disclosure. If an applicant doesn't share disability information, then we won't know that person's eligible for support, no matter how much they've had through school or college, or it's been on their record. We will only know it if they tick it or present themselves to us prior to the start or at the start. And quite often at the start is a bit late to begin to put together tailored support that we want to put together. After all, what the aim is to make sure that everybody has a layer of support that allows them to engage really effectively in every area of their studies. Next, please. And this is just a bit of a trawl down of the different range of students we have contacting us and we take account of. So dyslexic students, well, for dyslexia and dyspraxia, generally Student Finance England will want a full report that's been done by a psychologist during secondary education. Mental health conditions, just a note from the doctor or an NHS specialist will cover that one. Same again for long-standing illnesses. Autistic, something. Interestingly, autism and ADHD are two areas where the doctor might say awaiting diagnosis, currently being investigated, because Student Finance England have agreed that because the run-in to getting that diagnosis can be months and months or even a couple of years, therefore they'll accept a doctor's indication that somebody has a working diagnosis or is awaiting a diagnosis or something. So that's something to be aware of. So that isn't an exclusive list. That is an indication of how broad the disability umbrella has become, deliberately so, because we do want everyone who feels that their condition impacts on their ability to show their best and do their best. We don't want everyone to feel that they've got a fair chance of coming out with a first-class honours degree at the end of it. Okay, thank you. I'm going to hand over directly to Sarah now. Thank you, Sarah.
Thank you, Jackie. My name's Sarah Lamb. I'm a disability advisor at Sheffield Hallam University, and I'm going to continue from where Jackie left off and talk a bit more about disabled students' allowance. So we'll start by thinking about the types of support. And that support will vary depending on the needs of the student, the needs of the disability and the course they're doing. But the aim is to remove some of those potential barriers to student study. So not all higher education institutions have the same type of support. So whereas some support is funded through Disabled Students Allowance, there are also, the universities have, they have to put in reasonable adjustments themselves. So that can vary, and what they can offer can differ depending on budgets, depending on students that are supported before, but they do have an anticipatory duty to support students. So it's definitely worth when your students go to open days, or if you're supporting students who are hoping to start in September, so they're doing their exams over the next few months, for them to get in contact with the disabled student support team at the university they intend to go to, and then they can find out what their processes are. Like Jackie said, they are all relatively similar, but there can be subtle changes about how different teams contact and how they set up the support. So what kind of support might it be? Next slide, please. So like I say, some support is organised by the university, so things like exam adjustments, so support on the course. So they tend to be things that don't require a cost related to them, but they might also, like Jackie said, it could be a learning support plan or a reasonable adjustment plan. The legal term is reasonable adjustments, but different institutions have a different name for these things. Some call them a RAP, we call them a learning contract, but this is a document between the student and the disabled student support team that highlights what support they need on their course. And it also identifies to academic staff that the student has a disability. So some of the support might be face-to-face support, and that could be around managing studies, motivation, or it could be to develop study skills. Some students might require support workers, and that could be a lab support, it could be a personal assistant to help with mobility, getting familiar with the campus, it might be a note taker depending on the nature of the disability. Some universities will pay for testing for a specific learning difficulty, so you might have had support at school or college, and that might have just been a Form 8, and that might have just been from a meeting, there was a need and support was put in place. Whereas at university you might need more evidence, particularly if you wanted to apply for Disabled Students Allowance. So some institutions pay for that, some don't. Again, it depends on their budget, but the university you're going to will be able to advise you on that. And then what can Disabled Students Allowance cover? Well, it can cover a number of different areas. The key thing to note with Disabled Students Allowance is it's not a fund of money that you get in your pocket. It's based on a needs assessment, and that can cover things to do with travel to university. It might be equipment or software, or if you need ergonomic equipment. It could also be support workers, so study skills tutors, mentors or sign language interpreters, and all that would take place within the needs assessment, but can be tweaked and adjusted as you go through your studies. Next slide, please. So how do you set up your higher education disability support? So the key bit to do, which Jackie mentioned, is to disclose your disability on your UCAS form. If students haven't done this, they will usually get other opportunities to do it. So they can contact the disability team directly. They can enrolment, they can give information about a disability because they'll be asked again. But again, that can be that can slow down accessing support. So if they haven't put it on their UCAS form, really encourage the student to contact the university that they're hoping to go to, and then they can start them on that process. If a student isn't sure about what evidence they might need, then by all means contact the Disability Service. I'm supporting students and have been since March this year who are coming in September. So we're more than happy to have a chat with you, even if you might be your first choice, but you might not know whether you're coming to us. We're more than happy to help you, because whatever we help you with now will make a difference whichever institution you end up at. And because it gets so busy in September, the more you can do early on, the better. So like Jackie said, we don't request information from schools. We rely on students disclosing that information to us. If they would then want to share with us EHCPs or diagnostic reports from when they were younger, then that's more than useful. But we don't get that automatically. Next slide, please. So what is Disabled Students Allowance, shortened for DSA? Well, it's a government-funded allowance that covers the cost of specialist support, and that could be support workers, equipment, software, photocopying and printing, and a taxi allowance. All the support is individual to the student. So what that means is that for some students, they might get a support worker, they might not get specialist equipment. For other students, they might get equipment, they might not get taxi allowance. So it's not a one size fits all. It's very much worked out what support you need. The best thing to do is to access the University Disability Services and apply for Disabled Students Allowance. So who's eligible for them? Most UK students, if they're eligible for a student loan and a tuition fee loan, it's not means tested, then they should be eligible for DSA. And the DSA goes with the student to any university, and the fund's not paid directly to the university. It may be paid directly to suppliers of equipment or one-to-one support, but it doesn't come through to the university. And so if you had a needs assessment in the summer and you ended up going to Cardiff instead of Sheffield, then that equipment and support would move with you. It might need tweaking just before you start if the course is very different or longer, or the term dates are different, but that's something that your needs assessor will be able to support you with. It's not a loan, it doesn't need to be repaid, and it isn't means tested. And it also doesn't impact on any family benefits. They're useful things to know. The fund is aimed at level 4 and higher courses. If a student's on an access course or they're on an apprenticeship, they wouldn't be eligible for Disabled Students Allowance, but still get in touch so the university support can be put in place. Next slide, please. So the application process is lengthy for a Disabled Students Allowance. You apply using the online Student Finance England portal to apply for your student funding, finance and DSA. So it'll ask you a question, do you want to apply for DSA? If you've already applied for student funding and you didn't apply for DSA, you can still go back and apply for it at a later stage. You'll then need to submit evidence of that disability. And like Jackie's mentioned, that might be a full diagnostic report for something like dyslexia. It could be a letter from your GP if it's related to your mental health difficulties. There's a really useful form on Student Finance England's web pages, and you can give that to your doctor and they can complete. It's a very short form. It's just got tick boxes on it, but it covers all the information that SFE need for approved medical evidence. So that can be a useful tool as well, particularly if you've got a working diagnosis of autism or ADHD. So that's when you have been referred for an assessment for ADHD or for autism, but you've not had the appointment yet. So they call that a working diagnosis, because obviously that process of getting the appointment can take longer than, for some students, longer than their course. But then that would give you access to support from the university and through Disabled Students Allowance. So how is all this support kind of like worked out? Well, what you would do is you'd have a one-to-one meeting, and that could be in person, over the phone, or face-to-face with a needs assessor. Now, a needs assessor will be someone who has experience of disability. They're not assessing whether you have a disability. They're working out what support you need for that disability. So that's really key, because I think if people have heard horror stories about PIP, or they've had real battles to get an EHCP, once approval has been given for a needs assessment, there is no doubt that you're entitled to that support. It's the level of support that they're working out from discussions with you. Then after that assessment, a long report's written, and that will go to Student Finance England, and you'll also get a copy. Students will also get a copy. And then students will get a letter from Student Finance England explaining how to proceed, and that usually comes by email. There has been some changes in DSA over the last 12 months, which means that the people who provide the equipment will now contact the student directly. So that does make it a little bit easier and hopefully a smoother process. But again, your disability advisor will be more than happy to support you and support your students with accessing that support, because that's the key bit, really. Like Jackie mentioned, apply for DSA early. I always think in my head Easter, so if a student's starting in September, apply in the Easter beforehand, and it takes at least 3 months to complete. And that is frustrating for the student and for ourselves as well, to try and get support in place for September. So yeah, just encourage as much as you can for students to apply early. Thank you. Next slide. So bit of a checklist now for helping students to prepare for university. So encourage DSA, UCAS disclosure of a disability. What that triggers, so if I give you the example of at Hallam University, all students who've disclosed on UCAS, we get information recorded on our central system, and then we can do mass mail outs to those students, and we can monitor what interaction they've had with us. So we ask students to register with our team, provide us with a bit more evidence and a bit more information, and we're looking at ways to make that process easier, and also to make it quicker to get the reasonable adjustments in place when they start. So if you need to get hold of medical evidence, if you've not got it already, or evidence of your disability, the University of Sheffield have got a how to provide evidence, and like I mentioned, on Student Finance England's web pages, they've got a form that you can give to your GP that they can fill in. Any offer of transition events, take them up. The information, I think, for students, it takes a long time to process and to filter through. And you know, that's why the benefit of you supporting your students as well in this will really help. Contacting the accommodation office if they need any adjustments, if they need deaf alerters or things like that, or they need accessible accommodation, then yeah, by all means get in contact. In terms of, there's also a need obviously for preparation for independent living. If they require carers, then that becomes a more complicated process. That's not through DSA, that's through social services. But your disability advisor will be able to support you with that, and talk you through the different elements of where the different funding comes from. Also, students replying through clearing, which they quite often do, encourage them to contact the disability services as soon as they've put in that request for that course in August, because obviously we need more time then, as much time as possible to get things moving. So key takeaways: talk to your disability team at the university you're going to. Setting up support takes time, and many students can contact us at different stages of study. So it's worth saying that you might have a student who has had quite stable mental health but has had issues in the past, and I think, well, I probably don't need support when I'm at university. But it's better to go through the process so the funding's in place to then access the support at a later date when they need it. And again, the same, putting in support kind of preemptively is a lot better than trying to do it retrospectively. But students do get diagnosed throughout their course, and again, we'll support them with that process. Next slide, please. So I'm now going to hand you over to Stacey from the University of Sheffield. She's one of our students and she's doing a part-time master's in social research. So I'll hand you over to Stacey.
Hi, so I'm Stacey. I'm currently studying at the University of Sheffield, and I've been through the DSA process and getting support for my autism while at university. And as I think Sarah mentioned, I also got diagnosed while I was at university doing my undergraduate degree. So it can happen any time as well. Like if the student's unsure, like what counts as evidence, or they're struggling with this, it's never too late to get a diagnosis. I know lots of people that have gone through that process, and it's really helpful that the university's there to provide that advice and support while you're going through that. And so for me, the process of getting DSA, it is quite a complicated, long process, but luckily there's lots of people that have done it before. Your students do it every year. It does change slightly every year, but I think that's fine when you've got so much support available to you. For me, it was quite an easy process because I've done it before. So all I needed to make sure I had was my evidence in. I'm sorry, my cats are fighting. So to make sure I had my evidence in, and for me that clearly marked areas where I would need support. So when it went to a needs assessment, I chatted through with a lovely lady, and we just chatted through things I need support with at university. So that's like maybe lectures or the ways that I study and how that could be improved, and how I would find like studying generally. So for example, for me, I have some text-to-speech software, which is really helpful. And so it's times when I'm just like not able to type or I'm too tired, text-to-speech software has been really helpful for me. And of course, that's funded by DSA. And of course, having things like a laptop's been really helpful, because without that, I wouldn't be able to run my assistive software. Things like Grammarly as well, I found really helpful in making my words sound like university level, which some people might worry about, but there's lots of support there. Yeah, I know lots of people that have taxis as well, but for me, I'm fine with that. And that's how they know what support you need. They chat to you. So some things that I don't struggle with, other people might. So they just get to know you and find out what you would benefit from. And then also during the year, it can change as well. So I've just had new software recommended to me because I've had another needs assessment, because I thought my needs had changed, and also my laptop was a bit dead because I got that before I started my course, and so they helped me with that. And then I'm trying out a new software, see how that improves my studying now, and I'm probably getting into my master's, where it's a lot of work. So even during the process, you can help suggest other things that might help them better, or a lot of the time I would say yes to things, or recommend students just say yes to things that I recommend, because you never know, until you try it, if it's going to help you or not. And that's what I did. And some things haven't been helpful, but some things have. And I think that's what the great thing about DSA is, you can just try things if they suggest it, and then you know what works and what doesn't.
Lovely, thank you, Stacey. That's great. We'll move on to the next bit of the session, and then at the end we can take any questions that anyone has got to either Stacey or the team. So just a little bit now, we've done sort of all of the information given in terms of the disability side, but we have got, just to mention, some more resources that we have that obviously lots of people will see at open days at any of our institutions. Now, this new resource that we've had updated and rebranded recently has a lot of valuable information in it that can support yourself, and then to support those young people or adults go through anything that's related to a health condition, mental health, anything like that. So please do download that. If you do need physical copies, we can access them as well. But at the moment, we have got them just downloadable with a few copies. So please just let us know if you do want any physical copies. Our website has a lot of resources on it, and on that website is also lots of recordings and things. We've got case studies from students who have got different disabilities that are at higher education, whether that's a college higher education institution or a university. But all of those are there, not just for disabled students. There are other resources as well for other cohorts of students, so care experienced young carers and mature students as well. And there is also a parent and carer resource. So if you have any parents or carers that are, struggling with anything or finding it hard to find any information, they can access our resource as well. So as I say, this is just an area for you to signpost to yourselves for any updates, and also any young person or parent and carer as well. So that's our website address. Obviously, we are going to put up a feedback poll. We are on the next slide I'm going to put up is our contact details. These will be sent out with the presentation, so please don't rush to write it down or anything. They will be sent out. I am going to launch another poll, and I'm going to stop sharing just because I'm hoping that I can relaunch the poll that I sent out originally. I don't know whether in the chat function people can see that that other poll, so I'm going to try and just launch this one. And then while we're launching that and you're updating that, it is anonymous. Please do put any questions you've got in the chat, because we are more than happy to answer them now. Anything that you've got when you speak to students later date, please do come back to us and we can help. So I can obviously triage them out to lots of different people. So if you've got a question, you might think, oh gosh, I'm not sure that might not be something that someone can resolve. What happens is we will find someone that can resolve that question. We will all do our best, whether that's me going to student finance for any questions, or obviously our teams here at the universities. We will make sure that we get some answer for you. I think the key takeaways are that it's the terminology, a lot of it, isn't it, in terms of how different it can be at university, but also the key message is any students with disabilities have got a lot of support out there, so they shouldn't feel like they can't go because there won't be the support that they perhaps get at school or college. They might think that it's a bit more personal because it's smaller institutions, but actually there is a wealth of support and support basically out there for them. So please do obviously speak to them. I'm going to launch it now, but if you can add any questions in the chat as well. This will be, if it loses off your front screen, it will go into the chat function, but please tell us something you have gained from today's session, because that helps us to look at what we can include into our sessions. I am going to stop sharing. I don't think Teams is never very kind to me, so I'm going to see if you might also in the chat see another poll. If you do, it'd be great to see if you can populate that. The one that says following this session, how would you rate? I know people have fantastically filled in the other one, but should also be a following one. If you can see that in the chat, please do populate that. Otherwise, I don't think I can add one at the moment because I'm in the event, so it won't let me add it. Oh, maybe I can. No, I can add a new poll. Hold on. Bear with me. Give me 2 seconds. Good job, I can type quick. Too many answers. So you should now get that, should be coming on your screen as well. But if you could populate that as well, that would be fantastic. I will look in the chat. Let's see if we've got any questions in there. Hold on. Don't think we've got any questions at the moment. Obviously, please, if you do have any questions after this session, please do drop me an email. As I said, they are in the presentation, and that will come out in the next week or so. But in the meantime, I will put my direct email address. So if you have any questions after this session, please do drop me an email. I can't see any questions in the chat or the Q&A. No questions at the moment. So I'd just like to say thank you so much for joining us this evening, this tea time, and we don't need to take any more time up of your day. So thank you so much for joining us, and as I said, please get in touch. Thank you to our panel. Thank you. Thanks, Emma. Yep, we've all gone. We can stop the recording, Emily. So I think that was 6 for quite a lot of it, and then 5 I think it went to, which isn't as good, but it's interesting what we're trying to do now with our events